The Medical Knowledge Corporation presents The Patient's Guide to Lumbar Spine Micro-Disc Surgery. This video presentation will answer the most common questions presented by patients who are considering lumbar spine surgery. We will review the process you have undergone thus far to reach this stage in your treatment. We will inform you what to expect after your surgical procedure, and we will provide you with instructions for your recovery. Please review this presentation thoroughly, along with the information and instructions given to you by your surgeon, as you take the next steps toward a healthy lifestyle. Before we discuss the operative procedure itself, let us review the process by which you and your surgeon have taken to decide that surgery may be indicated for your condition. Let's meet James, who has experienced many of the same challenges that you have. James remembers that simply bending over was an agonizing experience.
My back pain was making life miserable. My work was suffering. I even had to give up things I enjoyed, like fishing with my son.
Common symptoms associated with low back pain can be one or all of the following: pain in and around the low back region, pain in your legs, which can extend below the knee, numbness and/or weakness in your legs and feet, bladder and bowel control problems. These debilitating symptoms can appear suddenly from a related accident, as they did with James, or they can occur gradually over time from degenerative or arthritic conditions. However, when they occur, we know how miserable they can be and how important it is for you to resolve them. That's why you may have gone through a number of tests and exams to best determine the cause of your pain and how to remedy it. A quick review of the lower back, or lumbar spine anatomy, will give you a better understanding of your condition. The lumbar spine is made up of 5 large bones, called vertebrae, or vertebral bodies, and your tailbone, which consists of the sacrum and the coccyx. Each vertebral body is separated by the disc, which acts like a shock absorber. This area of your spine carries the majority of your body's weight, which accounts for the larger size of the vertebral bodies in this region. The natural curve of this part of your lumbar spine is called a lordotic curve, or lordosis, which also helps support the weight of your body. Starting from the sacrum, which is referred to as S1, and moving up towards the head, the lumbar vertebral bodies are referred to as L5 through L1. The spinal cord runs down behind the vertebral bodies of your spine and ends around L1, forming a bundle of nerves called the cauda equina, which continues down through the sacrum. The spinal cord and cauda equina are surrounded by bone and extends from the vertebral bodies and forms an arch from behind, which is called the lamina. The bone that extends back from the vertebral body and connects to the lamina is called the pedicle. The nerve roots exit the spinal canal on both sides and at each level. These nerve roots control the muscles' actions and also give sensation to your legs and pelvis. The spine is surrounded by many soft tissues that include muscles, ligaments, tendons, and fatty tissues. Now that you have a basic understanding of your lumbar spine's anatomy and the symptoms that have occurred, let's review the methods used in diagnosing your condition. Like James, you started with a thorough physical exam by your surgeon, and then you may have had one or all of the following tests performed. X-rays. X-rays show the bony structures of the spine. They can be the first step in determining any irregularities that may be causing problems. Dynamic X-rays, which include flexion and extended bending, may also be helpful in detecting abnormal motion between your vertebrae. M.R.I. and C.A.T scans show both the bones and the soft tissues surrounding the spine and can help diagnose things such as disc herniations and bone spurs. These images are often used in conjunction with X-rays. An E.M.G. nerve conduction velocity study. These tests may determine the extent of any nerve damage you may have. A myelogram places a special dye in your spinal sac to highlight any compression on a nerve which may be causing your symptoms. This study is usually followed by a CAT scan. A discogram places a special dye into a disc to help determine where your pain is coming from and analyzes the structure and integrity of the disc itself. One or any combination of these diagnostic tests, along with your physical exam, assists your doctor in accurately diagnosing your condition and in recommending the best course of action to be taken for your recovery. James wasn't surprised to hear his diagnosis of a disc herniation at the L4, L5 level.
I knew it had to be more than a pulled muscle. When the doctor told me I had a large disc herniation that was pressing against the nerves of my lower back, it made sense. Once they found the problem, I just wanted to get it fixed.
Like many patients, you may have gone through a conservative treatment approach first. Conservative treatments include physical therapy and rehabilitation in conjunction with medications, such as anti-inflammatories, muscle relaxers, or epidural injections. In many cases, this may be all a patient needs to return back to his or her normal routine. In other cases, a patient, like James, may choose to stop conservative treatment early or skip conservative treatment altogether and proceed with surgery as an alternative for recovery. Like James, you have been diagnosed with a condition that may require surgical intervention as the next step. This condition can be one or more of the following. Disc herniation. A disc herniation occurs when the structural integrity of the disc has been damaged. Typically, the damaged disc places pressure on either the cauda equina or the nerve roots. Disc herniation disease may be caused by sudden trauma to the lower back or by repetitive stress to the area. This condition in the lumbar spine can cause pressure on the nerve roots. This pressure on the nerve roots and its associated symptoms are called radiculopathy. Radiculopathy can cause pain, numbness, and/or weakness, which may extend down into your legs. This condition in the lumbar spine can also cause pressure on the spinal cord or cauda equina and is called myelopathy. Myelopathy can cause pain in the lower back region and the legs, as well as weakness and stiffness in the extremities and/or a loss of bowel and bladder control. When a disc herniation occurs in the lumbar spine, it may require surgical intervention. The goal of surgery is to accomplish one primary objective: decompression, removing disc material that may be pressing on the nerve roots and/or spinal cord. Earlier, we reviewed the symptoms of a herniated disc. Now we will briefly cover what surgical procedure your surgeon may choose to perform. In order to take the pressure off the nerve created by the herniated disc, your surgeon may choose to perform a micro-discectomy. In a micro-discectomy, your surgeon creates a small incision on your back in order to expose the lumbar spine. Muscle is gently moved away from the bone, exposing the lamina. A laminotomy is then performed, where a small opening is made in the bone, thereby allowing access to the spinal sac, nerve roots, and herniated disc. The affected nerve root is then gently pulled away from the herniated disc so the disc fragment can be removed with specialized instruments and/or a laser. In some patients, your surgeon may choose a less invasive approach called a MED, microendoscopic discectomy. In a MED, a tube is used to create a tunnel through the muscles to expose the lamina. Thereafter, the laminotomy and removal of the disc fragment is performed through the tube. This may reduce some postoperative muscle discomfort at the surgical site. Like James, you have reached the point where your surgeon recommends that a surgical procedure is the best option in treating your low back or lumbar spine problem. Before your surgery date, you may be asked to visit the hospital for some routine lab work. This visit is a short one and ensures that the hospital, the anesthesiologist, and your surgeon have a complete medical profile to prevent possible complications during the surgical procedure and to make your hospital stay more enjoyable. You may also meet your anesthesiologist and other medical personnel at the hospital before your procedure to further educate you about your hospital stay. Remember to always follow specific instructions given to you by your surgeon and hospital prior to your surgical procedure. The following instructions are what you may expect. Discontinue any medications as instructed by your physician prior to surgery. Discontinue all nicotine products because nicotine may slow down the healing process. Limit your vitamin intake to a multivitamin. Eliminate alcohol consumption to further avoid surgical complications. Please remember, with any surgical procedure, complications may occur. These complications may include infection, pain, weakness, numbness, advanced degeneration above and below the operative level, paralysis, loss of bowel and bladder control and sexual function, stroke, death, anesthetic risks, blood clots, damage to nerves and blood vessels. Some of these risks may lead to the need for additional surgery. This list may not be all-inclusive, and, as with any aspect of your surgery, all questions should be fully discussed with your surgeon before your consent for surgery is given. Nevertheless, thousands of these procedures are done each year as a highly effective way to correct lumbar spine disorders with good success. Once the procedure is completed, and after you leave the hospital, much of the success of your recovery relies on your commitment to follow your surgeon's postoperative instructions, which may include the following. Take care of your incision by keeping the area clean and applying ointment once or twice a day to help prevent infection. Avoid swimming or bathing for at least 4 weeks after surgery. Wear any brace you have been given as instructed. You may shower 4 to 7 days after the procedure. Please remember to avoid all nicotine products. Call your surgeon's office immediately if your incision develops redness or drainage, you develop a high fever in the first few days after surgery, you have an increase in pain, numbness, weakness, or swelling in the legs, you have any questions regarding your surgeon's instructions. If any emergency condition develops, dial 911 on the telephone or go immediately to your local hospital emergency room. Your postoperative care is an investment for a full and successful recovery. Just remember that this is a team effort and your part is just as important to your recovery as your surgeon's. Also remember that a positive attitude will enhance your results.
I finally feel like I can get my life back to normal. No one should have to live with that kind of discomfort when there's such a positive way of taking care of it. Thanks to my doctor, I can enjoy my life and family again.
We hope that this presentation has given you a better understanding of the detailed and caring process that your surgeon and staff have undertaken to provide you with the best care possible. If you have any additional questions, please contact your surgeon. We wish you continued improvement and good health.